Hello, everyone. So, have you ever stopped to think where a disease really begins? From something as simple as the common cold to something as complex as cancer, it all starts with just a single cell in trouble. Today, we're going to zoom right in, down to the microscopic level, to understand how the health of one tiny cell can actually determine the health of an entire person. This, my friends, is the absolute foundation of all medicine.
Right, so before we dive in, let's just get our terms straight. The word pathology, it comes from the Greek pathos, which means suffering. So when we're studying pathology, we are literally studying suffering. And what we're going to see today is that all suffering, from a medical point of view, starts with that single cell in distress.
All right, here's our game plan for today. First up, we'll talk about the basics, why cells are so incredibly important in the first place. Then, we'll look at how they can cleverly adapt to stress. After that, we'll get into what happens when that stress is just too much, leading to injury and even death. We'll tie it all together with a real-world clinical case, and then at the end, we'll do a quick round of questions to test your knowledge. Let's get started.
So, to truly understand and treat any disease, you've got to think like a detective. And every good detective asks two fundamental questions to get to the heart of the matter. These two questions are the absolute bedrock of pathology.
First, etiology. Why did this happen? What is the actual cause? Is it a virus, a faulty gene, maybe a toxin? That's the why. And second, pathogenesis. How did it happen? What are the exact steps, the mechanisms, that take that initial cause and turn it into the disease we see? That's the how. If you can answer these two questions, you're well on your way to understanding any condition.
Now here's something really cool. Before a cell gets injured, it doesn't just sit there and take it. No, when it's faced with stress, like an increased workload or a hostile environment, it first tries to adapt. It changes itself to survive.
So what can a cell actually do when the going gets tough? It can't just pack its bags and leave, right? It has to find a way to adapt. And it turns out cells have a whole playbook of survival strategies. 4 main ones, in fact, that they use to cope with stress.
And here they are, the 4 big ones. And let me tell you, these are absolutely key for your exams. Think of it like this. Hypertrophy is like the cell bulking up at the gym. Hyperplasia is like calling in reinforcements, making more cells. Atrophy is downsizing, to save energy and resources. And metaplasia, well, that's like changing jobs to something better suited for the tough new conditions. The key thing is, all of these are reversible attempts to survive.
This slide is a brilliant example of hypertrophy. Just look. On the left, you've got these nice, normal, slender, smooth muscle cells. But now look at the right. These are cardiac cells from a heart that's been under the strain of high blood pressure. They are massive. Why? Because heart cells can't really divide to make more of themselves, so they do the next best thing. Each individual cell gets bigger. It bulks up to handle that intense workload. That, right there, is hypertrophy in action.
But what happens when the stress is just too much, or it goes on for too long for adaptation to work? Well, that's when we cross a very important line. We move from adaptation into actual cell injury.
Okay, first, let's set our baseline. This is what healthy looks like. These are normal kidney cells. See how clean the channels are? The borders are well-defined, and you can see those nice, dark, healthy nuclei in each cell. This is a happy, functional cell.
All right, now let's add a bit of stress. Let's say we cut off the blood supply for a little while. We call this ischemic injury. See the difference now? The cells are all swollen with water, they look much pinker inside, and they're even starting to form these little bulges or blebs. But, and this is crucial, look at their nuclei. They're still there, still intact. At this stage, if we restore the blood flow, these guys can bounce back. This is what we call reversible injury.
But what if that blood supply stays cut off? Well, then we cross the point of no return. This is necrosis. Look closely here. The nuclei, gone. They've literally dissolved. The cells are just falling apart, their membranes have ruptured, and they're leaking all their contents. This is a dead cell. There's no coming back from this.
So, we've just seen necrosis, a really messy, chaotic death caused by an injury. But is that the only way a cell can die? Turns out, no. There's a second, much more orderly way for a cell to die, and it's just as important for us to understand.
Okay, pay attention, because this slide is pure, high-yield exam material. You must know this table. Necrosis is basically cell murder. The cells swell up, they burst, spill their guts, and cause a huge amount of inflammation. It's always pathologic, always a bad thing. On the other hand, apoptosis is more like cell suicide. It's a clean, programmed death. The cell shrinks, condenses itself, and gets quietly eaten by its neighbors without any inflammatory fuss. And this is often a totally normal physiologic process. So which part of the cell is at the center of this huge life or death decision? It's the mitochondrion. If it gets really badly damaged, say from a lack of oxygen, then energy production fails, and that leads to that messy necrosis. But if it receives specific internal signals, like if the cell's DNA is damaged beyond repair, it can kick off that clean, programmed death by apoptosis. So it's not just the cell's powerhouse, it can also be its executioner.
Okay, let's move on and see how all of this theory comes together in a real-world clinical scenario that you will absolutely see in your practice: a heart attack or myocardial infarction.
A heart attack is the perfect real-life example of the sequence we've been talking about. A coronary artery gets blocked. That's ischemia. This starves the heart muscle cells of oxygen. That's hypoxia. Their mitochondria can't make ATP anymore. This triggers a whole cascade of failures, pushing them right past reversible injury and into necrosis. The muscle cells die.
So how does this knowledge help us in the emergency room? Well, remember how we said necrosis is messy? When those heart cells die and burst open, they leak their internal proteins into the bloodstream. One of these proteins is called troponin. By doing a simple blood test and measuring the levels of troponin, we can know for sure that heart cells have died. This is pathology in action, giving us an incredibly powerful diagnostic tool.
Okay, time for a quick fire round to make sure all this is sinking in. These are just like the questions you might see in your university exams, or even in PLAB or USMLE Step 1, so get ready.
All right, think back to what we talked about with adaptations. The heart is under a lot of stress from high blood pressure. So what do its cells do to cope? The answer is hypertrophy. That's right. Cardiac muscle cells have a very limited ability to divide, so they can't undergo hyperplasia. Instead, each individual cell gets bigger and stronger to handle the pressure, and that's what makes the whole heart get bigger. Okay, next one. Think about the cause: a sudden, total lack of blood flow. Is this going to be a planned, clean death or a messy, accidental one?
Absolutely. It is necrosis. To be specific, it's a type called coagulative necrosis. Severe ischemia is the classic trigger for this kind of unregulated cell injury that just overwhelms the cell, leading to that membrane rupture, inflammation, and messy death we call necrosis.
So I want you to always remember this. From a heart attack to liver failure, every single disease has a story, and that story always begins inside a single struggling cell. By understanding this language of the cell, adaptation, injury, and death, you are learning the fundamental language of all medicine. Thank you for your attention.